Now we're going to be looking at 5 specific cardiac signs of a PE. Number 1 for me is cardiac output. There's going to be a decreased cardiac output because of decreased left ventricular preload. Now this occurs primarily because of something we spoke about in the last video, which is decreased blood flow through the lungs. So basically the right ventricle is going to be pumping blood through to the lungs. Because of the vasoconstriction within the lungs, and because of the obstruction within the lungs, there's going to be less blood flowing back from the lungs into the left atrium. This is going to cause a decreased preload, and we know that ventricular contractility is largely dependent upon preload. So that's why there's going to be less cardiac output. That means decreased blood pressure, and that means there's going to be sinus tachycardia. 44% of patients with PEs present with sinus tachycardia. Number 3 is inverted T waves in the leads of V1 to V4. That's a right ventricular strain pattern. 18% of patients actually present with a right bundle branch blocker. And then only 10 to 20% actually present with a classic S1Q3T3. Don't have that sign as your go-to. And as always, do a whole patient assessment and then make your differential diagnosis.